Hey, Dr. Blaney, how are you?
I'm great, Brittany. How are you today?
Great. I'm so excited. Welcome to our third hospital bedside chat. One of the creative things that Sky High came up with to keep the public and all of our Sky High supporters informed in regards to what's going on with all the facilities that we love and support so heavily.
Great. I'm thrilled to be here with you.
Yay! So in 2018, for everybody that doesn't know, we pledged $20 million to support Texas Children's Cancer Center. And that was really through two major projects. And we'll get into those today with Dr. Blaney. But the first was to support the development of the Immunotherapy Center, which is the first and only pediatric immunotherapy center in the country. And so very important and needed for so many children and families battling pediatric cancer, as well as supporting Dr. Poplack's efforts with Global Hope in sub-Saharan Africa, bringing treatment and allowing fellows to be educated to then turn into pediatric oncologists themselves and be able to diagnose and treat kids in some very poor places in the world. And so for those of you who don't know, yes, it was a big pledge, and although we are facing some challenging times, Sky High never stops. And so Dr. Blaney is going to tell us a little bit today about the Immunotherapy Center.
Sure. Well, first of all, I just want to say it's really a phenomenal pledge, and we are so excited about it. And our Immunotherapy Center is a very special place at Texas Children's. Why don't I just give you a little bit about Texas Children's, and then I can go into more detail about the Immunotherapy Center. So Texas Children's Cancer and Hematology Centers is one of the largest, if not the largest, centers in the country that cares for children and adolescents with cancer and blood disorders. And we provide family-centered care that focuses on the treatment of the child's underlying disease first and foremost. But we look at the psychosocial needs of not only the patient, but their entire family, because as you can imagine, cancer impacts the entire family. So we are on the forefront of innovative research to understand more about the diseases that we treat so that we can develop the most effective, least toxic therapies available for children with cancer so that we can cure their cancers. And that's where really the Immunotherapy Center comes in. That is one of the types of treatment that is on the forefront. And Sky High, through their $10 million pledge, funds not only research to help us continue to develop those therapies, and it also has a floor designated in the hospital specifically for the treatment of children who are receiving immunotherapies.
That's exciting. I hope everyone was able to hear that from Dr. Blaney. I mean, this is the source, and this is why it's so important to continue to support Sky High for Kids, for us to be able to fund a project at Texas Children's Cancer Center. And like Dr. Blaney said, it's one of the biggest in the country. Dr. Blaney, would you tell everybody a little bit about your role at Texas Children's Cancer Center?
Sure. So I am the director of Texas Children's Cancer and Hematology Centers, and I like to say I have the best job in the world. I get to work with the best and the brightest physician scientists, and then a whole medical team of nurses, pharmacists, social workers, child life workers. The list really just goes on and on. But it takes a team of clinicians, of healthcare providers, of researchers to treat children with cancer and other life-threatening disorders of blood, and to make an impact on the field and to help us advance the field. And I'm so fortunate that I get to lead this team and make sure that they have all of the resources that they need to do their jobs. They are so passionate about their jobs. They feel a sense of urgency. As you know, children are diagnosed with cancer every day, not only here, but across the world. And it's our mission to bring them effective, less toxic treatments as quickly as possible.
Yes, it's so important. I mean, you can imagine the types of treatment that, were created back in, the 60s and 70s and 80s. And so now with just so much more research and scientists and people like you working day in and day out, we can just get things, better and better and better. So about how many patients does Texas Children's Cancer Center see annually, roughly, Dr. Blaney?
So I would say we see annually of new diagnoses about 600 children with cancer and about 1,500 children with blood disorders. And that is a large number of patients for any center at the United States. So what that means is that we see not only the common cancers like leukemia and some types of brain tumors, but we also see the rarest of the rare, so that at our center we have expertise not only in the common, but also in the things that don't happen very often.
Right. And so 600 newly diagnosed just on the oncology side and 1,500 on the hemoc side.
Correct. Hematology, yeah.
Children are in treatment, you would say that, an average leukemia treatment, correct me if I'm wrong, Dr. Blaney, is anywhere from 2 to 3 years, right?
You're exactly right. So you can take that number and it's a few thousand patients in active treatment on a daily basis. And we follow these children not only through their treatment, but through the rest of their life. When they become long-term survivors, we continue to monitor their health to make sure that we are looking for any types of side effects that they might have resulted from either their tumor or the treatment that they received, so that we can intervene as quickly as possible if they do experience one of those long-lasting side effects.
Okay.
But we have a lifelong relationship with them.
Right. Once a patient, always a patient, right?
Right.
So Sky's been working with Texas Children's for several years now. It's been an unbelievable partnership and friendship, most of all. And can you tell our supporters how important it is to have Sky High as a partner at Texas Children's, and some of the things that we do to provide comfort in relation to our carnivals, as well as the funding for care and research, kind of what impact that has on TCH?
Sure. So as Brittany said, Sky High is a true partner and wonderful friends, and a partnership that we cherish. They are helping us to make a huge impact. And I'll save the treatment impact for the second part, but not only do they provide us funding with research to help us advance the field, but they also have comfort programs that they fund. And they have programs such as the Big Love Cancer Care, which provides family with basic needs such as meals, or when they're in the hospital, delivery of groceries. They also, if a patient is having a bad day or a bad week, our social workers can alert Big Love to the fact that the family needs something to lift the child's spirits, and they'll give us a special, token or gift that helps them through that difficult time. And those kind of basic needs are so important that we pay attention to them. And because Sky High helps us do that, I can't tell you, there aren't words to express the impact that has on the patients and their families. They are so incredibly grateful, and it makes a difficult journey something that, I know it sounds strange, but something that the families have fond memories of because they feel the love of the community.
Yes, it's so important. And we love supporting Big Love. Biggest service-based organization in Texas that actually physically delivers these items to patients and families every single week, 52 weeks a year. So when Jessica and her team approached Sky High to help with additional funding for the extended floor, we didn't want to see 20 families not be able to receive those items. And so we also knew we weren't going to start a division that did what they already do best. And that was like total proof that if you collaborate together and you work together, that you can really do some big things.
You're exactly right. And I'll also say the impact of the carnivals and the other activities. It's a time that benefits not only the child and the family, but also the community and the people, the staff that are there seeing our children. it's a time when the children can forget they're at the clinic. They're just doing regular activities and they're smiling, and their parents, sometimes it's the first time in weeks that they've seen their child laugh and play just like a normal child. And that brings them so much warmth to their heart and gratitude to see how happy their children are, even if it's, if it's for 5 minutes, 10 minutes, the rest of the day. It's incredible, the impact.
Oh, that's amazing to hear. So Dr. Blaney, we opened the floor, Sky High for Kids floor in February, or at least we had our unveiling in February. Can you tell everybody a little bit about what the floor provides at the center?
Sure. So the 7th floor is a floor that provides additional bone marrow transplant beds, which is a type of immunotherapy. Many children who are undergoing transplant have immunotherapy either before or after their treatment. And a space where children who are receiving immunotherapy can come for that infusion of the cells or whatever they might need. In addition to that, the floor has amenities for the family, such as a lounge, washer and dryer, that are very, very important, especially when you're in the hospital for a long period of time. There's a room, not only do we have a playroom, but a room dedicated specifically to art therapy that has an art therapist. And those kind of things help us pay attention to the whole child and treat the whole child and not just their underlying disease.
And that's what's amazing. I mean, it's the whole child. It's every single thing that a normal child that is not, dealing with this health crisis would get up in the morning, brush their teeth, start getting ready for school, go to school, have recess, play with friends, toys. I mean, just all the things that you go into a normal child's life. And so that's what I love so much about Texas Children's, is that you do treat the whole child and every experience that they should be having at that age.
Right. And the other thing you sometimes see on the floor is our pet therapy dogs.
Oh, we love them.
It's just wonderful to see Elsa, and the child life worker with Elsa brings a smile to everybody's face, not just the children, but their parents and the staff, and it relaxes the whole atmosphere. And those children and Elsa bond. It's incredible.
I know. I'll never forget walking into Cynthia, one of the patients that we stay in touch with now. She had just had her arm amputated, and imagine at 15 years old what that would be like. And the puppy dog was sitting in her bed. I mean, she was just like as content as can be and just so happy. And if that's what it takes, that's what y'all do. It's just so amazing.
It's incredible.
So okay, so let's get a little bit into our very, big global crisis that we're facing with COVID-19.
Mm-hmm.
I can't imagine the new restrictions at the hospital. I mean, I know y'all have told us, unfortunately, no carnivals, no patient visits. We can't do anything to bring anyone else from the outside in. But just the regulations, going through this pandemic, what or how is TCH adapting? I think a lot of people don't really know what's going on inside.
Yeah, so TCH has been on the forefront of making adaptations to make sure that our hospital and our clinics are as safe as they can possibly be for our patients, first and foremost, for their families, as well as for our healthcare providers. And so because of that, as Brittany said, there are restrictions not only at Texas Children's, but at every healthcare facility across the country. And right now, some of those restrictions are tough on patients and their families. They're tough on us as providers, having to have us limit the number of visitors. But I view this as a temporary situation until this pandemic is past, and we will then get back to a new normal. It's going to take some time, and that time is going to be longer than any of us like, but we have to be patient. But because of that, right now, there's questions when you enter the hospital about whether you've been sick, about whether you've traveled. We all get a little armband that you can see so that we know we've been screened and it's okay for us to be there. We wear masks when we're in any patient care area. Right now I'm in my office, so I don't have my mask on.
Right.
But, it's a very safe environment, and we rapidly implemented here testing for COVID-19, one of the first institutions in the Texas Medical Center to do that. We can do screening, get our results back the same day. Soon we'll even have a more rapid test that we can get back in hours. So we are paying attention to every single detail, adapting rapidly because information changes every day. But the exciting thing is now we're at a point where we are starting to plan for recovery and having operations be more normal. It might be a different normal in the short term because there will still be restrictions, but we're looking at returning to a more normal and phasing that in safely for all of our patients and their families.
Well,
but I want everybody to know that if a child needs treatment, we are here to treat them. If it's a new diagnosis, if it's ongoing care, there is not an interruption in any of that. We do it safely and efficiently for those patients.
Fantastic. Thank you for letting everybody know that. I think that's important because we know, today numerous children unfortunately will be diagnosed. And so where do they go? And, Sky High actually gets quite a bit of those referral calls initially from, a parent that has just been, told the diagnosis and they're like, Brittany, what do I do? And first question is, where are y'all located? What's the diagnosis? And then let me get Dr. Blaney involved. And you've been amazing to do that several times. I remember at midnight one night, you were reading over some documents from a family that, we knew very well that had just been diagnosed. And so that just shows and proves how much y'all care and just will do anything and everything that it takes to be able to, see if this is the right thing for this child and family. It's remarkable.
Yep, we're here for patients and their families 24/7. And I do want the community to know that the COVID-19 in children, fortunately, does not impact them with the severity that it does in adults. So, yes, if you're a child getting treatment with chemotherapy, your immune system is always more vulnerable, but we have not seen the severity or the intensity of infections. In fact, most children are asymptomatic, and the only reason we know is that a family member had COVID, or when we were doing screening to make sure it was safe for them, that they turned positive even though they don't have symptoms. So that's the majority. But if a child is positive, we take that very seriously and monitor them very closely.
Okay, thank you for sharing that, Dr. Blaney. I did want to let some people know a little bit more about the treatments and really treatment options for cancer patients. I think, if you could tell us a little bit about how those treatments or treatment options have changed over the past few decades, because I know even just hearing personally that maybe leukemia, like the term of treatment used to be 3 years, and now I'm hearing it could even be as low as 2.5. Is that right?
Yeah. So treatment for childhood leukemia over the past several decades has really improved, first and foremost. And that's because we work together and collaborate across the country's institutions to do clinical research trials to find the best treatments for children. Historically, that treatment has been drugs called chemotherapy. Everybody's familiar with that term. And those medications kill the cancer cells. They also have a lot of side effects on any cell that's rapidly dividing in your body. And so you think of things like nausea, vomiting, losing your hair, common side effects. Our treatments can also have long-term side effects. They can impact every organ system in the body, including the heart, the lungs, and so that's why we monitor our patients. Over the past decade, and really the past 5 years, though, we've made huge strides in a type of treatment called immunotherapy.
Yes.
And what immune therapy does is really helps the body's own immune system fight the cancer. So there's many types of immune therapy. The one you most commonly hear about in the news is something called cell-based or CAR T cell therapy.
Mhm.
And I'll tell you a little bit about that.
Okay, great.
So T cells are a type of white blood cell, and our body has a variety of types of white blood cell. But we can draw a small sample of blood, just like when you get a blood draw at the doctor, isolate the T cells that are in that sample of blood, engineer them in the laboratory to recognize what's different about a specific cancer cell and a normal cell, expand or grow the T cells in big amounts, and then give them back to the patient. And we do that through a small IV infusion. And once they're in the body, those T cells then are armed with to recognize what's abnormal in the body, the cancer, and attack the cancer cells. And then they can grow and divide and continue to attack the cancer cells.
Amazing.
And that type of therapy is been very impactful in childhood leukemias for children who relapse, getting them back into remission, sometimes sustaining that remission, or sometimes making it possible for them to have a bone marrow transplant. We are now also, or we have been researching immune therapies for all types of cancers. And other cancers in the body have been more challenging: brain tumors, muscle tumors, bone tumors. But fortunately at Texas Children's, we have an internationally recognized group that's leading the way in developing immune-based therapies for children with those solid tumors. And for the first time ever, we are seeing responses. That means tumors are shrinking and in some instances going away with some of these novel therapies that are targeted specifically for a specific type of cancer. So as you might imagine, when you're making a treatment that's tailored to a patient, that's a very labor-intensive process, especially when you have to take the cells, modify the cells, grow the cells. All the research behind that and the treatment itself is very, very expensive. But there's no cost that's too high when it's your child or when you're curing a child. But that work isn't possible if it wasn't for partners like Sky High, who help us fund the cutting edge research that lead to the discoveries that make this treatment possible.
Well, that's amazing. And that's what's so important for our donors to understand is that, without Sky High and without their support, we could not fund cutting edge research and cutting edge treatment and therapies. I mean, here it is right here. And so the Immunotherapy Center was a huge decision for Sky High to fund, and our board really looked at all the angles, and we are so proud of the decision we made to be able to impact so many families and so many children and really be able to give what you need at Texas Children's, so you can move forward. It really does blow my mind when we hear about some of the things that y'all are waiting on for funding, right? I mean, you can't do X because you don't have Y. And it's like, wait, what? What do you mean you were waiting on $725,000 to buy this machine for the Tumor Biology Center? And everybody's like, yes, we didn't have the funding. And it's like, whoa, this is why it's so important, so we can advance treatment, right?
And as you might imagine, discoveries happen rapidly and technology changes, and we have to stay on the forefront for our patients. And that requires a lot of expensive modern technology, and Sky High has helped us so that we can make those incremental discoveries that are so important to making our treatments more effective. And I will say, I mean, immunotherapy is phenomenal. In my lifetime, I've seen advances, but this advance is incredible. And we are seeing some miracles right in front of our eyes because of immunotherapy.
That's amazing. So this immunotherapy center is in Houston, Texas. It's at your Texas Medical Center.
Correct.
Or children that are receiving treatment in other or at other facilities around the country benefiting from this immunotherapy center?
Well, I would say that everybody across the world ultimately benefits from this immunotherapy center and the discoveries. There are some treatments today, because of the way that, as I said, we grow the cells and manufacture them, that requires very special facilities that only a few centers in the country have. But our scientists are working on making immune therapies off-the-shelf products. Like when you get a prescription for an antibiotic, we call that off-the-shelf. Anybody can take that, or other chemotherapies. Right now, the chemotherapies are tailored, but we are actively every day making advances in developing products that could be sent to other centers or that could be commercially available.
Amazing.
And that is true today for some of the treatments for leukemia. Now they are available. They all take time, but that is the goal. And discoveries made here benefit children across the country and across the world.
So speaking of across the world, can you tell everybody a little bit about the powerful program called Global Hope, which is part of our $20 million commitment to Texas Children's? Can you kind of enlighten everybody about what that program is all about?
So Global Hope, which was developed by Dr. David Poplack, who was the director of Texas Children's Cancer and Hematology Centers before me, and the reason that I'm here. Global Hope stands for Hematology Oncology Pediatric Excellence, and it was founded by Dr. Poplack here at Texas Children's Cancer Center in 2017, and his vision was to create a comprehensive program to improve pediatric hematology care in sub-Saharan Africa. And why is that important? Here in the US, there's about 15,000 new patients a year who are diagnosed with cancer, and our cure rates exceed 80%. It's not good enough. That's why we're doing all the research we're doing. But compared to sub-Saharan Africa, where 100,000 children are diagnosed every year, and only 10% of them survive, it's incredible night and day, right?
Yeah, night and day.
So our goal, and really because the child is born here versus Africa, that's the difference between being able to be cured or not cured sometimes, because of the resources. And those resources are not just physical resources like the hospital, but also experts in the care of children with cancer. And so Global Hope's goal is to bring treatment to all those children, but we need to have the capacity and the sustainability. And that's what we want to do in Global Hope. So what we're doing is training physicians, pediatricians, nurses, other healthcare professionals from Africa to become pediatric oncologists and healthcare providers for patients with cancer and blood disorders. We're working with pharmaceutical partners and other corporate sponsors across the world to make sure that those children have access to the drugs that they need to effectively treat their cancers. And then we're improving the healthcare infrastructure by establishing centers of excellence and training programs that are in Africa, so that this can be, as I said, sustainable and go forward for generations to come.
Yes, and that was so amazing to see. Myself and Brad, along with Greg from our board, visited Uganda and Botswana last year, and then Christina and Jesse got to go to Botswana and actually see it. I mean, we walked the cancer wards. We saw the difference in the way that children are, able to be in a clean environment. Mothers were sleeping on the floor. The beds were back to back to back. And like you said, it's beyond the infrastructure. Okay, you can have all the brick and mortar you want, and you can, have the drugs, but if you don't have the experts, then you can't really treat anyone. You can't treat these children. And so that's what was so amazing to see Sky High. You know, the $10 million pledge to Global Hope is directly funding the education. And I got to meet 12 of our fellows that are literally in school becoming pediatric oncologists because of us. Like, it was, I can't tell you how warm my heart was. I mean, I was hugging these people and they were like, thank you. Thank you for supporting my education so I can go back to my country to treat children. I mean, we are graduating the first pediatric oncologist in all of Malawi. And you think about that and you're just like, wait, what? The first? It's unbelievable.
Yeah. So Sky High is funding training of Global Hope sites in Uganda, Malawi, and Botswana. And because of Global Hope, we've had dramatic success to date. We've trained more than 1,900 healthcare professionals and successfully treated more than 8,000 patients. And as Brittany mentioned, the fellowship training program, which is absolutely incredible. Here at Texas Children's, we treat 8 new oncology fellows a year. And at any given time, I have 32 of them just at Texas Children's. And all of sub-Saharan Africa. Now we have 12, but it's a start, and it's an incredible start. And those physicians are so dedicated and so bright, and they're going to make such a huge impact. In their training and their success is really, we're grateful to Sky High for making that possible.
Thank you, Dr. Blaney. I mean, I'll never forget meeting some of our fellows, and you know, I mean, just like squeezing Ann and Moses, and I mean, just, you know, it was crazy because we're the same age. You know, they were in their 30s, and so I just looked at them and I said, like, it doesn't get any better than this. Like, you already went to undergrad and you now applied for this Global Hope program, and you have this unbelievable burning passion to again treat children in your country. And they were just like, yeah, and we just want to do it. We want to save all these children, and we would have never been able to do that without Global Hope and Sky High. So it was just, you know, it's 12 people that will fund, and then they will then save hundreds of thousands of children. And that, I remember that moment for our board of directors when we looked at each other and said, what is our moral duty here? When you're making a decision to fund something across the world, right? And our donors are here in the United States, what is that? What does that look like? And I looked at everybody and I said, our mission is to save lives. It doesn't matter where. We didn't say save lives in Texas. We said save lives. So do we want to lay our head down at night knowing, or in our lifetime knowing, that we saved hundreds of thousands of children, or a couple thousand children? I mean, it was like, it's a no-brainer, you know?
No, the impact's going to be incredible. These individuals are selfless. They work in hard conditions, but they just go night and day, and they're going to train the next generation so that we are going to have that success.
Unbelievable. Well, thank you for letting everybody know a little bit more about Global Hope. And so before we end our bedside chat today, I'm going to talk a little bit about the part of our mission that we, and I think our donors, you know, really love the most. I mean, it's not a secret that if you can see, touch, and feel exactly what we're doing, it brings an experience to your life that is unforgettable. And that's being able to go to the hospital and actually participate with the children. You know, some of our programs include blanket making, and so we go and hand deliver those blankets, you know, on the outpatient cancer floor. And I always tell people, you know, when you go to the hospital, it doesn't matter what hospital or even a doctor's office, it's always freezing cold. I mean, rightfully so. You're trying to keep the germ count down. But, you know, I remember vividly always walking in there and seeing kids and parents like with a white bed sheet, right? Because that's what y'all are allowed to give out. And we would come around the corner and just say, hey, would you like to pick one of these fleece blankets? And I mean, they would just light up. And then we'd leave that outpatient cancer floor, and you'd see 50 families just hunkered under their blankets while their child's receiving chemo or waiting for their next appointment. And it was just like, wow, look at what our supporters did today for these for these families. And so beyond that, our hair donor program, our adventures program, but going to the hospital and doing that with the families, what does that mean to Texas Children's?
I mean, an incredible amount. I really don't have adequate words to express the impact and how phenomenal it is on our patients, our families, for people to know that the community is behind them, for parents and patients to know that. It means the world. It lifts their spirits. It gives them hope. And just the human touch is so powerful.
I know we are certainly praying for that day to come in the future. I mean, I know there's going to be and regulations, and it's going to be a slow process. And I loved your word. Patience is so important right now. The word patience right now more than ever. We will be ready on the front lines. I know our regional event committee members, our volunteers, even our donors are going to be eager to get there to really show some love and support to those families that unfortunately, are really not being able to receive that, outside besides, their own family. And
Right.
Blaney, are y'all allowing siblings to visit right now, or is it only the parents?
Right now, it's only the parents that are able to visit. And it's difficult, but thank goodness we have technology today that we can see each other from afar. It's not the same, but it's something. And we make sure that our patients are able to do that.
Oh, that's fantastic. Well, just remind everybody for us one more time how important it is for y'all to continue to receive funds from Sky High. And so, during this time, Sky High's in a perfect storm. We are heavily funded by the energy industry, which is in a very, very tough situation with low oil prices, as well as gathering the community together in masses to fundraise through our special events. And so we are pushing forward, trying to be as sensitive as possible to the community, but we're reminding people over and over again that our mission is not canceled. Cancer is not canceled. And we have to pivot, get creative, and we have to continue to raise funds. So can you tell everybody why that's so important?
Well, I think the fundraising is so important because it's through partners like Sky High that the research gets done. Yes, we're very successful at getting grants from the government and other funding agencies, but they're not enough. They don't even come close to being what we need. We have a sense of urgency. This research can't wait 1, 2, or 3 years. We need to be doing it now, today. And that's why these funds are so important, because research is expensive. We are doing cutting edge research. And as Brittany talked about earlier, just some of the equipment that we need to help us get the results, to make the discoveries, is phenomenally expensive. And we can't do it without the community and without partners like Sky High.
Well, there it is, everybody. We are going to continue to push on more than ever and be creative. So, our mission isn't canceled. Cancer isn't canceled. We are going to maneuver and be sensitive to everyone's situations right now in the world. But we are going to continue to try to fundraise to support facilities like Texas Children's Cancer Center. So in turn, these families can see the light at the end of the tunnel, right?
Yeah. So Brittany, as you know, we love working with you and the whole Sky High team. And as I just said, your efforts are really crucial to our success. So maybe you can tell us how Sky High is going to continue fundraising and doing community outreach during this pandemic.
I'm glad you asked that question. And so, when this first occurred, the team got together and said, hey, we need to get creative quickly. And so we put our brains together and came up with one idea, which is going to be hosted next Thursday, and that's our Stay Home Gala. So we figured if everybody's home, and you're not spending money on normal activities that you would, whether that's wining and dining or going play golf or going to concerts, sporting events, people should have a little bit of extra cash at this time to be able to enjoy some entertainment from the comfort of their own home with the entire family. And what's so neat is registration is free of charge. So even if you're not going to give, we want you to join our gala. Okay, we want you to tune in. John Rich is going to tune in. Miss Texas has a message for everybody. Ori and Lauren, we have some newscasters locally, and we're just really excited about that. We even have a performance from Sam Harris at Ex Ambassadors, and so it's going to be a very entertaining evening, 7 to 8:30. You can get dressed up and order some takeout, or you can cook and stay in your pajamas. We don't care. But we do think that everybody will be surprised to see our amazing auction items. We are so grateful to everyone who donated an auction item at this time. So we put these silent auction item packages together, and we're going to be on a live stream. I already have my blow-up microphones ready. And I'm so proud of Jamie and Grace for putting all this together, and the backbone of our team and Project Mockingbird coming in to support. But it's going to be a live stream on YouTube. So that was the first way that we knew we could help and really adapt with the environment, right? If we can't gather in a big facility, we're going to gather at the comfort of your own home. And in addition, at the end of May, we are going to host a telethon. And again, there's no reason why you can't pick up the phone from your house, right? Or from your desk. And so each person is going to call 20 of their closest friends and family, or maybe their friends from college or high school buddies or people from work, and just going to ask to make a pledge of any amount to Sky High. We're going to have some goodies to give back. Our donations start at $25, but even if you want to give $5 or $10, and so we have kind of built an army of an at-home call center. And so we're really excited about that at the end of May. We're really hoping and praying that the economy and people are back at work by then. But, like you said, Dr. Blaney, we have to continue to move forward. We can't just say, well, COVID-19's here, and so we're just going to put fundraising on pause. We can't do that. Now, we've got to adapt with the environment. We have to be sensitive with the times, and that's what our team is doing, being innovative, creative, and we're just reallocating our talent in different areas. So 2 dates to remember, April 30th, May 27th, and so that is our current short-term plan. We have talks about extending our plan throughout the summer, and so that looks like some peer-to-peer fundraising that Kim Yonka is going to be in charge of, and then we're looking at some other ways to fundraise when we're finished with these two platforms. And then we are currently planning to host all of our internal fundraising events starting in August in Lafayette, Louisiana. We know that the crowds might be smaller, and we know that the donations might be smaller, but we rather go and get back in that community and try than not try. So the fall hopefully is going to still, we'll host all of our normal internal events in each region: Houston, Lafayette, San Antonio, Midland, etc.
That sounds phenomenal. And I know that your stay-at-home gala is going to be a lot of fun for everybody.
Yeah. No, we're really excited, Dr. Blaney. So that's our plan. So we want everyone to stay tuned for more information and to continue to follow us through these hospital bedside chats. I mean, it's not very often where you get to hear from the director of oncology at one of the biggest cancer centers in the country. And so, Dr. Blaney, we are so thankful for your time today, because we know that you have a lot of other very important things to do. And so just a big reminder that we're super grateful to everyone who continues to support Sky High for Kids and our mission to end childhood cancer.
Well, Brittany, we are so grateful to you, the Sky High team, your board, but also to all of your supporters and the community for everything that you do to help us work as a team to impact childhood cancer and make cure a reality. So thank you.
Thank you, Dr. Blaney. Everybody go to skyhighforkids.org. You can click the donate button at any time. Thank you for your support. Love you, Dr.
Bye. Take care.
Hope to hug you soon.
Yes. Take care. Bye-bye.